This is Smita, and you're watching Doctors Speak at Medicircle. Today, we are speaking to Dr. Lalit Ranjan Manik. He is co-founder, MedTel and Datweal, has over a decade of innovative experience in primary care, digital health, Tele-triage, and much more. He has also worked as a consultant with World Health Organization India, Ministry of Health Saudi Arabia, and National Health Service UK. So he has covered an entrepreneurial experience journey of more than a decade. Welcome, Dr. Lalit, to Medicircle.
Thank you, Smita. Thank you, Medicircle.
So to begin with, Dr. Lalit, how is MedTel helping the healthcare industry?
Yeah, I'll start something like how we jumped into entrepreneurship. Okay. So when we are in medical college, we have seen patients closely, and basically from the rural and remote areas, because I was studying in a government medical college. So every day we see patients suffering in the hospitals, and there are resource constraints in the government hospitals basically, and people are dying for common ailments like malaria, diarrhea, tuberculosis, infectious diseases, and which can be avoidable. So that there was this spark came from there only, that we choose to do something beyond clinical practice, because every doctor, when he just get passed out from medical college, he wants to do a PG post graduation in clinical medicine, like in a medicine, pediatrics, orthopedics, whatever. But to be honest, I'll be telling you, like the day we passed out from college, we know that there are so many clinicians, there are so many doctors will coming up, but the problem is something else. We need to bring technology, we need to bring innovation into day-to-day health practice. So from there only I felt, okay, I have to do something else. So we started off ideating things. I'll be telling you that 2009, 10, when I was just passing out from medical college. So we found that, okay, it's time to do something. It's not just, okay, ideating things and all. Let's start something. So we started my first enterprise, that is Hello Doctor 24/7. So we started with solving problem of remote rural people. They need healthcare information, they need teleconsultation, they need health advice. And what we shopped around 3 lakh patients across Odisha, even West Bengal. So what we learned from that, so there is a acute need in the ground, and we must have a sustainable model to deliver. So thereafter, I went to UK. I did my master's in public health from United Kingdom. I got a scholarship from British Council, and I went there, studied there, and also got the opportunity to work with NHS, National Health Service UK. And that learning, I came back and I started working with WHO, World Health Organization, tuberculosis program. So after that, I went to Middle East also, in the Saudi Arabia, working as a consultant for government of Saudi Arabia. So then after we started medical healthcare, so all the learnings and even my previous entrepreneurial experience in Hello Doctor 24/7, then the MedTel was born. So again the motive was that only to solve the unreached rural and unreached masses. But what we felt really that to solve the rural and the underserved population, we must have a sustainable model, because government is spending less than 2% of GDP is being spent in healthcare. And if you see, to build a sustainable healthcare in rural areas, we have to get support. So we found that, okay, we need to have a 2 different model. For one is for the urban, one is for the rural. So the MedTel, what we are doing, we have 2 models of care for rural and urban. So basically, our model is to empower healthcare providers like the pharmacists, doctors, hospitals, even nurses, even last mile healthcare workers. Because what we felt, you know also, because you are in the same sector. So there are there are applications, technology always given to the doctors and the all healthcare providers. So, but what we felt, we need to empower them with the user-friendly technology. So when we thought about rural areas, we created digital health clinics because we know the doctor-patient ratio in India is one is to 1700. But if you see in the rural areas, the doctor-patient ratio is around 1 is to 25,000, 50,000. So that means there are a lot of doctors in urban areas and we don't have doctors in rural areas. So what we are doing in MedTel, we are creating digital health clinics by its asset light model. We are giving training to pharmacists, even the medicine shops, even the lab technicians, even the health workers. We are working with a PPP model with Government of West Bengal. We are creating health workers on the ground. It is just not just creating health workers. We are giving them technology. So technology. That means we are giving them mobile health technology solutions like teleconsultations, IoT devices, point of care devices. So they are having this technology so that they can extend the service to the last mile. So if you see in India, there are 10 lakh doctors, but there are 2 to 3 times quacks. Might have heard about quacks. So quacks usually provide health service in the rural areas. So we wanted to empower not the quacks, those who don't have basic degree, but we empower the health workers, pharmacists, nurses, with the government. Also, privately we work with the medicine shops and other remote telehealth centers. So this is rural model that we empower the last mile workers with technology to provide health service on the ground. Number two is the urban. That we felt that urban areas, the doctors also need to empower, and the doctors and hospitals. So you might have seen there are so many teleconsultation platforms have been after post-COVID.
Yes.
Post-COVID, everybody is providing teleconsultation. We have telemedicine solutions. But with our experience, what we felt, telemedicine is not just about seeing over a video and audio. Just like you are seeing me and I can give you advice, I can prescribe medicines. It is not like that. Because I need to understand your minimum vitals, your patient history. Then only I can advise you, I can give a justice to you. So what we are providing to the hospitals and doctors, again, the mobile technology with IoT devices, remote monitoring solutions, integrated with telemedicine platforms. So presently we are working with a couple of hospitals, even hospitals in Mumbai, in Apex Hospital in Mumbai. We are providing remote monitoring solutions so that patients from the from home, they are sending vitals to the hospitals, and we are providing the app, mobile app, even the pulse oximeter, blood pressure, all are connected devices. They don't have to do any manual entry in the app. The data will be directly sent to the hospitals, and also integrated with we have clinical algorithms. We have added into our applications where there is a personalized care is delivered to a patient, and also doctors at a certain time, one doctor is able to manage 100 200 patients, because he doesn't have to worry about the patient, because the notifications, risk stratifications have been already integrated in our applications. So there are two models. One is urban, one is rural. Urban for urban doctors for remote monitoring and teleconsultations, patients can provide vitals to hospitals and doctors. Rural, we are doing for the empowering healthcare providers, and also they can extend services to the ground. Yeah.
And how does Datweal personalized health journey through a connected network of smart health stations?
Yeah, when we started Datweal, because during the journey of MedTel, we saw in the hospital, if you have gone to hospital, you must have seen there are 100, 200 people might be just roaming around here and there because they're waiting for their relatives who has been admitted in the hospitals. So we felt, you know the numbers that in India there are 135 million people are obese, and 80 million people are diabetic, 200 million people are hypertensive, but almost 50% of population that don't know about they are already having high blood pressure. In similar case in the diabetes, almost 50%, that means 30, 40 million people don't know they are already being diabetic. So we felt we need to provide an access point where people can have choice to get screened. So the Datweal is a self-service health kiosk. So you just stand on the kiosk, and you have to enter your some personal information. So it will analyze you. I have clinical algorithms and body impedance analysis, so that immediately there is body composition analysis, along with you will get a diabetic risk score, then you will get a cardiovascular risk score. So you have already installed in 14 hospital in Bangalore that people just come in, and when they just stand for 2 minutes, 1 minute, I think less than 2 minutes, immediately they will get a text message and a WhatsApp message that your diabetic risk score is this and your cardiovascular risk score is this. We are following the clinical algorithms that has been evidence-based clinical algorithms. So it gives a immediate score to a person. Okay, I may be diabetic, I may be obese, I may be having high cardiovascular risk. So immediately so that will, when patient comes to the same place again and again, so he will know his risk score, and we will build a personalized health journey. That means we always remind the person, okay, it will change also a behavioral change in a person. Suppose today I am just saying you are diabetic, your score is high. So when he goes to home, he share with his family members. Suddenly there will be a behavioral change. So we are working with lot of data sets what we are generating, and AI enabled. I can say that is not at the very preliminary stage. So I will be telling you what is the roadmap ahead. We are building a AI enabled behavioral change platform where we can provide a personalized care to the patients, and through screening, health risk assessment, and multi-channel telehealth platforms. Yeah.
That's good. So, Dr. Manik, so these people who are standing or who are attending to their patients who are admitted in the hospital, when they might be knowing about their healthcare conditions, they can again access the doctors, the healthcare providers whom they have an access to. And I think the better they get themselves assessed, the better the chances of cure and prevention is.
You're absolutely true. Like when the risk assessment is done, the bot will react with them. So we have a chat bot through WhatsApp. So the bot will chat with them. So the bot will guide them to the right care. That means whether you need to do exercise, when you need to do lifestyle modifications, whether you need to talk to a dietitian, whether you need to consult a doctor, whether you need to do a preventive health checkup. So that the bot will guide also. They can do a book appointment for the health checkup, teleconsultations, everything. So that's why it's just an entry point for any person, so that it's a health gateway. Like once you stand on that, it will guide you throughout the life, because we have the database and we always remind you and engage you throughout the life.
That's good. That's good too. So, Dr. Lalit, tell us, you have co-founded a lot of businesses like Hello Doctor, MedTel, Datweal. So, how has your journey been?
Yeah. So when you say a doctor is going to start a business, everybody will laugh. So doctor will start a business means he will do his clinical practice or he will do a clinic. So other than clinical practice or anything else, when the doctor is going to be an entrepreneur and he's doing something, in my medical college in the fourth and final. Pardon?
So we have so many, sorry to interrupt.
Sorry.
We have so many docpreneurs, and I think doctors are doing really great businesses.
Thank you. So why I told this, when I talked to my father that I'm not going to do any clinical PG in clinical medicine, and then he told me, he tried to counsel me many times. Even sometime he asked me, let's go and meet my friend who is a pediatrician. So he took me to him, and he told me that you need to tell him something, that your journey and all. So just imagine that when this is generally all parents, every parents will tell. So but I had a different idea that I'll do something else. It took really 5 years that to convince my parents that, okay, I want to do something else. I am not here for the clinical. I will sit in a clinic because I felt the problem is bigger. I need to engage myself, and my friends are doing fantastic job. They are really hardworking, but I had not that appetite to do a clinical practice or to join a process in clinical medicine. So second to, I'll say that the ecosystem is not there for the doctors, because if you'll see the now things are getting really evolving things. But if you go back 10 years back, so we are struggling to get mentored, to get help from the incubators. So that is very important. So if you are in an IIT or any big like a tough premier management college, they have ecosystem to adapt new ideas, new innovations. You'll get platforms. But in medical, not a single medical college you'll find incubator. Now I think there are very few incubators are coming in the medical college. So if we don't have the incubation in centers in medical college, we don't have the incubation accelerator in medical college, then how can the students, the medical professionals, they will know about there is another way where you can also be an entrepreneur and you can innovate something.
Yes.
So my journey so far, I will be telling you, it is self-exploring, everyday learning. Till today, we are learning. We are not good at everything. So every day, I also am learning what you told me that how could you reach to 6 lakh doctors already? So that is a really wonderful job you are doing. So every day we're learning, and I'll be saying to share my doctors friends that want to become entrepreneur. So I'll just share one story. Like one guy had asked me in LinkedIn, "Sir, you have already been an entrepreneur, and what advice you'll give me?" So I told him, if you cannot convince your parents that you are going to start a business, but how can you convince your customer? So this was my advice. So whenever the doctors wants to do business or anybody else, so first of all you need to convince your parents, because doctors, when you become passed out from medical college, your parents and colleagues he will have a stetho, and he will just come to treat me, and he will advise me everything. So that is not going to happen when a doctor becomes an entrepreneur, because he doesn't get time to sit in a clinical practice.
Okay.
So the journey, and also I'll be telling you two of my co-founders. One Dr. Somyakan Das, who is from IIM Lucknow, who has done MBBS, then has done IIM Lucknow, MBA from IIM Lucknow. So when I got to know, because he was my junior in another medical college in the same state, like in Odisha. So when I got to know about him, that he told me that I have never thought of applying a post graduation in clinical medicine or PG in medical college. So I told him I have done the same thing. So he told me, "Oh, you are on the same category." So what I'm trying to say, like, it is very rare breed of people in medical college now jumping into entrepreneurship, and there are also few doctors who has already like succeeded in the clinical practice. They are also jumping into something in AI and all, but very premature, I can say, in India. The culture, I'll tell focus on medical students, because the community you are addressing, the medical doctors, medical professionals. So they need to also choose that there is another way out beside clinical practice. You can be an entrepreneur, you can be a tech company, health tech company you can build by addressing challenges that you every day you face. Yeah.
Last question to you is, what is the experience while you were working with the World Health Organization?
Yeah. So when I came back from UK after completion my masters in public health, so I got the opportunity to work with World Health Organization. So basically in the tuberculosis control program, it's a revised national tuberculosis control program. Okay. So it's a wonderful experience, because WHO has its own set of guidelines. So it is always what my learning with WHO, I'll be telling you. Number one is you'll get a lot of mentors. You'll get mentors who will be guiding you to do things. It was a great learning first. Number one. Number two, I could work on the ground, because I was a consultant who was visiting the 30 districts. So conducting CMEs for doctors.
Okay.
So basically, my job was to conduct CME and the updated guidelines to share with doctors. And number two is I was also meeting private practitioners. So those will be notifying TB cases. So by meeting private practitioners in remote locations, remote settings, so it was great learning that how the really healthcare are delivered on the ground. And this learning helped me in my startup journey in MedTel. So also I got opportunity to meet with national level and international level consultants, those who have experience in Southeast countries, African countries, especially in public health. So I think my experience with WHO was really wonderful. And senior consultants, still I am in touch with them. When I have problems, I always talk to them. That what I need to do, how we need to solve the problem. And it is a wonderful time it is a joint program, again, Indian Medical Association, World Health Organization, and Global Fund. So still I'm in touch with them, that it is a great network. And always still some of them are still advising me to do things better every day. So I think it is a wonderful time.
Oh, that was really, really great. So I thank you, say thanks from the entire team of Medicircle to Dr. Lalit for coming to Medicircle and sharing your insightful views with us. And the most important thing, I happen to know that there are so many people who actually don't know about their critical diseases. Like there are so many people who are still not assessed, and they don't know that they have some lifestyle disorders like hypertension and diabetes. That is really a very alarming situation. And I think the Datweal that we have innovated would be really great to assess and for these patients who might be knowing their health conditions better. So all the best with all your ventures. I think both your ventures, MedTel and Datweal, are really great, both for rural and urban population. Thank you so much for coming to Medicircle.
Thank you, Smita, and thank you, Medicircle team, for your great effort for since I think for long years. And I hope you'll be reaching out more health professionals, and your journey what you have thought of connecting health professionals and sharing knowledge. I think that vision, I think I'll see next 10 years. You'll be one of the great player connecting doctors.
Thank you so much.
And building doctors' communities.
Yes, that is what we are trying to build. Thank you so much for your wishes. Thanks.
Yes. Thank you very much.